Hello and welcome to Movers and Shakers. I'm Ken Miller. Today I'm joined by 40th District State Representative Dave Buehler of Lansing. Dave, thank you very much for coming in today.
Thank you.
Just started the session here. We're recording this on January 19th. So I know we're going to have a give and take here, question and answer, and there's a good chance some of this or maybe most of this in the next week or two would kind of be outdated.
True.
So, because I know things can move fast
Yeah.
in Topeka, and we definitely want to have you back towards the end of the session, and we'll kind of recap what's going on. Good. All right. So the legislative session began earlier this month, and not surprisingly, taxes are probably the big gorilla issue in the room. As of right now, how many plans are being bandied about Topeka, and what do you favor so far? And I know there's going to be give and take, but what do you favor so far in terms of providing tax relief to Kansans?
Yeah. Okay. So. There are two primary plans, and I'm going to use a prop here. So
Sure.
Legislation may start out as a pen, but when it gets to April or close to May, it may be a pencil.
Mm-hmm.
So I say that in just a little bit because what you start out with, in many cases, is maybe not what you wind up with. But there are two primary plans. High level, in her State of the State address last week, Governor Kelly proposed Well, let me back up. There's a recognition on both parties that tax relief, and you said state 100-pound gorilla, there's a recognition by both parties that tax relief is the prime objective for this session, for the balance of this biennium. So with that in mind, during her State of the State speech last week, Governor Kelly proposed a tax relief plan that the total of it, and it really kicks in the next fiscal year. There's an element like about $25 million this year. Most of it kicks in next year, but it's about $365 million a year. Mm-hmm. So high level, that's the governor's plan. We can talk about what's in her plan in a minute. On the Republican side, or our plan, we have a plan very similar to what we tried to pass last year that the governor vetoed. That's about $500 million of tax relief to Kansans. So first, there's an agreement that we need to reduce taxes for Kansas, in part because we do have a budget surplus and we have fully funded our, quote, rainy day fund. Mm-hmm. When I was in the tax committee last year in March, there was an agreement, a bipartisan agreement, that we could sustainably cut taxes in the state by $500 million a year. So you have to ask yourself the question, there's about a $150 million gap between what the governor is proposing and what we are proposing. Now, where we are from a process or procedural standpoint, this is something very unique to the state. In fact, Chairman Smith said yesterday on the House floor, never in his years as a legislator has the House ever passed a tax plan before the budget was produced. And typically that happens in March or April. Right. So we are... and this was by design. Republican leadership back in October, November, were committed to delivering a tax plan that we could get out and debate in the first 2 weeks of the session. So we've met that commitment. Yesterday we passed our House tax plan, and it's roughly $500 million a year. So the points of agreement. Governor Kelly, so a year ago we proposed over time phasing out what's called the cliff on Social Security income taxes. Mm-hmm. Governor Kelly not only took that plan, but to her credit, she said, okay, let's eliminate all taxes on Social Security income. So that's one point of agreement. In our tax plan, we have that component. So
our senior citizens
yes.
like hearing that.
Oh,
right.
Absolutely, yeah. So before, and this is where, I mean, the way the cliff worked in Kansas, Social Security income is not taxed up to the point of $75,000, but if you make $75,000 and 1 penny, mm-hmm. all of that income becomes taxed. Mm-hmm. So not only have we eliminated the cliff for seniors, this bill has an elimination of taxes on Social Security income, so that's a big one. The second one is the immediate phase out of the food sales tax. And again, differences. Governor Kelly has said she's middle of the road, but she's vetoed repeal of that tax, I think, 3 or 4 times. Mm-hmm. She has it in her plan. We have it in our plan. And if our plan passes, it would be scheduled to phase out on the 1st of April. So actually, pretty
This
quickly.
year?
This
This
year.
year.
Oh yeah,
Okay.
this year.
All right.
So then the other elements there are there's a property tax piece in the Republican plan, which is actually one of the biggest parts of our plan. And that is not the same in her plan. In fact, I'm going to take a look. I brought with me just to compare the differences between the Democrat plan or the governor's plan and ours. So she has axing the food tax, an elimination on feminine hygiene and diaper sales tax, eliminating that. We talked about Social Security tax. In both plans, there is a standard deduction increase. So on your when you do your taxes, that federal adjusted gross income, Kansas gives you a standard deduction. Both plans agree that we should increase that. She took from our plan from last year, we had a banking privilege corporate income tax reduction. She took from our plan this year, put it in her plan, so she took a piece of ours. We have the same element in ours. She has a back to school holiday tax, and then she has a 20 mil residential exemption on property tax, and then also to increase the value, the first, today the way Kansas law works, the first $65,000 of your home valuation is exempt from personal property tax. Both sides agree to raise that to $100,000. So there's an agreement there. And again, her plan, when you average it out over the next 4 years, is about $360 million. Okay, so then when you look at the Republican plan, we have the many of the same things. The big difference, and this is the sticking point, is we have a single income tax bracket. So today there are 3 income tax brackets in this state. The proposal is to take it to one rate at 5.25%, and then to make sure that lower income earners aren't penalized, we exempt the first $30,000 of income. So it's actually, I've heard it said it's a misnomer. It's not a single tax rate, it's a dual tax rate, because those who earn $30,000 or less will pay zero income taxes.
Right.
So those are the big differences.
It's commonly called a flat tax.
It is.
So, right. But you mentioned the I guess you would call it the ceiling, the $30,000 ceiling, that if you make $30,000 or less,
yes,
you're exempted.
And so the difference today is that ceiling today is, I think, somewhere between $13,000 to $15,000. We've pushed it out to $30,000. Okay, so that's the starting point on the 2 plans. Now, procedurally or from a process standpoint, where it is, the Senate passed their version, and just the way this works, the Senate picked, because Governor Kelly vetoed our plan last year, or the Senate version, they picked up the components of our plan, passed it in the Senate earlier this week, and then it's the concurrent committee resolution.
Sure.
And so we passed our version of that yesterday, and so it's sent to the governor. So if we meet 10 days from now, one of 2 or 3 things can happen. The governor can veto that bill, she can sign it and become law, or she can do nothing and it becomes law after 10 days. So that's kind of where we are. There's a pretty high likelihood that the governor will veto our bill. So then the next question is, what's next? And I think we will find out soon. There's a good chance that we have the votes in the House
to
override her veto. Right. The challenge will be in the Senate because that's where it failed last year. But that's where taxes are.
You know, and again, I mean, you're explaining this to me more than what I've read in media, so I'm getting a little more detail. But off the top, what I would take away from what you just said, there seem to be a lot of commonalities.
Oh yeah.
I mean, and with negotiation, you would think that there would be some movement towards the middle. But I've heard the flat tax is what is the non-starter for the governor.
Well, and
even though it's not technically a flat tax, it's pretty close to a flat tax.
So let me add to that a little bit. So if you look at least 2 of the, call them the blue states around us, Colorado and Illinois, pretty progressive states, both have single tax rates, and they're at 4.something%. So those 2, and the reason they do that, so the reason you look at a flat or a single tax rate, you have to be competitive with the states around you. And I believe Iowa passed one last year. So when we're trying to make Kansas an economic magnet and to bring people to the state. We've had net out-migration for 2 decades.
Sure, right.
This is one of those things that I believe makes us more competitive with our surrounding states. So we'll see. It certainly is
Right.
It's going to be exciting in the next 2 weeks. Let's put it that way,
Right,
one
right.
way or another.
And that's, people are going to be watching this 3 and 4 weeks from now, and just understand that if you're watching this at the beginning of February, things could have changed. It could be settled. Who knows? It could be settled. Right. Okay. I don't want to spend any more time on because it's going to. We know it's going to change.
Okay.
Let's move on. Expanding Medicaid. And you and I have talked about this before. It's being talked up again early in this session. Similar efforts to expand Medicaid in Kansas have failed, I think, several years running now. So is there anything different about this year that might change the outcome for Medicaid expansion? I know I saw, I think it was yesterday or the day before, 150 physicians signed petition, whatever you want to call it, advocating for Medicaid. It's interesting, here in Lansing, I got a notice from Twin Oaks Retirement that they are now accepting Medicaid, which I found kind of interesting. So is there some movement where we might actually see Medicaid expansion in Kansas this year?
I think the short answer to that question is likely no, and I don't want this to come across and sound hard-hearted, and you have to look at the reasons behind that. When you talk about those physicians who are in agreement with them, many of them don't either fully take additional Medicaid patients. That's one thing. I mean, there's a limit that they'll take, and there's a whole lot. There's I think a list of reasons that the governor proposes that simply aren't true. So one of her points is it'll save rural hospitals. There's not one rural hospital in this state that is closed that would still be afloat if you look at what their Medicaid reimbursement rate would have been. Okay. And so there's a host of other reasons, but I would say this, and it's not that totally tuned out. You have to ask yourself the question: what benefit, or what's another advantage for possibly expanding Medicaid? And one of them is it's the reimbursement rates to hospitals. So that can be looked at separately. Not necessarily Medicaid expansion, but it will help the financial condition of some of those hospitals. There's I've had several conversations this past week with Senator Beverly Gossage, and Senator Gossage works to help Kansans get Medicaid, Medicare packages. So she's very versed in all of this. So it was a very educational conversation for me. But as I educate myself, there's a couple things that are true. Number one, the number of projected enrollees by any state, and I think I've mentioned this to you before, is usually 2x what is projected. So Kansas, if we say, okay, it's 150,000 people, it could very easily be 200 to 300,000 people that would go on Medicaid. Many of the people who are on lower income, have a lower income at around $14,000 or $15,000 a year, who have a plan on the Obamacare or the exchange, would be kicked off of their plan and then forced into a Medicaid plan. So that to me is not a good thing. The cost to the state over time will be at least 2x what is projected. And that comes in the form of a tax increase. And then I think the third element, and for me, is this. This state has a problem, and anywhere you go, I would imagine if I talked to the mayor, or you could tell me from the city standpoint, chief of police, we have a problem, we have an employment problem. We have a problem getting people to work, having enough people to work. Every state that has expanded Medicaid has seen, and this is kind of a scary number, anywhere from a 7 to 11% shrinkage in their workforce. So in a day when we are already trying to find enough people to work in mental health, to be police, firefighters, just any place, to take another 7 to 11% out seems to be very counterintuitive to me. But again, I apologize for the long answer, but I do think we can make some headways, and again, common ground, through looking at the hospital reimbursement rates. And that's a way to help chip away at this issue.
Okay. All right. Bills related to abortion have been filed, and there was one that I read about that would levy fines against physicians who provide abortion services. So talk about this issue, and maybe not specifically to that physician penalty. but that the likelihood anything might pass both houses, both chambers, it's almost certainly going to be vetoed by Governor Kelly. So maybe like Medicaid, we talk about it every session, but nothing ever changes.
Yeah, so on this one, my sense, just in the first 2 weeks of being on the floor, there isn't a lot of appetite to run those bills. The representatives that introduced that legislation are from Central and Western Canada, and I'm a pro-life legislator. I make no bones about that. But when the Value Them Both amendment failed a year ago, the voters convincingly
right.
sent a pretty clear message.
Right.
So again, I would say there's not been, I have not heard a whole lot of traction to even get that to or through a committee. I could be wrong there. My sense, and what I would rather focus on are, and again, the governor vetoed some of this legislation last year. Look, if we're truly pro-life, we need to look at pregnancy resource centers. We had a pregnancy resource tax credit bill that the governor vetoed. So and abortion is a very dividing issue.
Sure. Right.
I would rather try to put the rhetoric of the extremes behind and try to look at, okay, let's look at the whole life. Let's look at prenatal care and some of those other things. I think we can reach common ground there. And I would like to think that at some point, even though she vetoed them last year, that our governor could actually move towards that to the center and look at that part of the whole life.
Well, and the one thing you didn't say, and it stands to favor nothing really happening or changing, it's an election year for everybody.
Yeah.
So, yeah, you got that. Okay, maybe a little closer to home and a little more likely to see fruits. There are local efforts to push Leavenworth County transportation projects. We, myself and several elected leaders from Lansing and staff went to Lenexa back in October, and KDOT had been holding these regional meetings. They wanted to hear what the locals had to say. Improving K-5 has a lot of support, which, not that it surprised me, we knew it had plenty of support from Leavenworth County officials and staff, but the fact that for the first time I really heard some Wyandotte County people saying that they supported K-5 improvements.
Right.
And for those that might not know, K-5 basically would run from Lansing down, well, you would include Leavenworth in that, but from Lansing basically down to the Wolcott interchange there on 435. If you've driven that, you know you don't drive it at night. It's too windy. It's no shoulders. It's not a safe road at night for sure. But I digress. So we had this meeting. There was a lot of support for K-5. KDOT has been made aware of that support for K-5. There was a study commission, $250,000 study commissioned by Leavenworth County. K-5 was the number one project of that. So you're familiar with that study. You're familiar with what I'm talking about. So you've got people at KDOT. You've got legislative support. What are the next steps, or what are you hearing about the fact that Leavenworth County seems to be getting more traction now vis-a-vis Johnson County and Wyandotte County, who usually gets the bigger pieces of the pie?
Yeah.
What are you hearing about the fact that we might get some significant funding to improve some of our infrastructure?
Yeah. So I would say two things. First off, it is a little early in the session to see how all of the statewide KDOT projects are going to rack and stack. So that's the first thing, and you have to always kind of remember there's a limited pool of money in that in the what they call sometimes the bank of KDOT.
Yeah.
I shouldn't say that, but and that is we have to look at the priorities of all those things. So the encouraging thing to your point is for Leavenworth County, and then maybe even down to Wyandotte, where can we invest and get the biggest bang for the buck? So K-5 is one of those projects.
Right.
If Leavenworth County Commissioner Culbertson were here, he would be talking about his flyover
152
and the connection to the and another bridge.
Right.
I don't know that that one for two reasons, or a couple of reasons. Number one, it involves the state of Missouri and the state of Kansas, and then just the cost of it. It's a great idea, but it seems a little further out on the horizon than some of the immediate things that we can do with K-5.
Sure.
So I would say this: I haven't seen where everything's going to rack and stack, and I would pledge to do this. for any project that would affect Leavenworth County, specifically Lansing, I will be all in. I know last year, for example, on a couple occasions, Tim Vandal had said, "Hey, Dave, we've got this project. Can you put together a letter of support?" Certainly something that I can do easily. And then the other thing that I would pledge to do, and I may not have done as good as I would have liked a year ago, is to keep my the hat on of I live in Lansing, and when I hear of legislation or things that can impact the city of Lansing or Leavenworth or the county, I try to do a better job thinking, okay, do I need to pick the phone up? Do I need to call Paul Kramer in Leavenworth, or do I need to call Tim here? And again, that for me is just growth in this job,
right?
And hopefully I can do better. I don't know that I gave you the answer precisely that you're looking for on this question, but
and I don't think you could give me an answer because of the things that you said. Is it's still pretty early in the program for KDOT. One thing I did want to jog my memory when you were talking about this. What are your committee assignments this year?
Oh, sure.
Yeah.
I am pleased to have the same three I had last year, and assuming I'm reelected this coming year, I would really like to have these 3 committee assignments again. First one is the Fed and State Committee. There's a whole host of issues that come through that committee, that from liquor laws to you name it, and some that actually are going to potentially affect business here in the city of Leavenworth. Second one is Health and Human Services. So when we talk about things like Medicaid expansion or pregnancy resource centers, or I'm also on the interim committee for those with intellectual or developmental disabilities. And if we have time, I mean, a found passion of mine would be to be placing an emphasis on that rather than Medicaid expansion. And then the third one is tax. And again, so three great committee assignments, and I'm very pleased to have them.
Okay, all right, and we usually wrap up each of our interviews with a question like this. You know, we can read the Topeka Capital Journal, we can follow online the Kansas Reflector, different news sources, which has traditionally been the way I think most people, and me being a former journalist, it's the way I would keep up with what's going on in Topeka. But especially now that there are fewer reporters, they don't seem to be there as much. There are things I think that happen in Topeka, maybe not on a daily basis, but kind of fly under the radar. And it might be things that 2 months from now becomes the major headline. So what are you seeing, if anything, that's kind of flown under the headline or flown under the radar to this point? So
there's, and I'm going to try to put these together with 2 or 3 things that I'm interested in. Or I think that are, so back to property taxes. So when you study that whole problem, there is the problem of the spending, the taxing entities, what they spend, and where they get property tax money to do that. There's the issue of home valuations or property valuations. So that's there's another piece. And then there's the rate. So there was a resolution that was sponsored in the Senate last year, passed in the Senate. We didn't have time to work in the House, but to cap the rate at which property valuation can go up. So I am interested, and I am hopeful that becomes a constitutional amendment that we vote on in November.
Like limited by a percentage per year?
Yeah, so the current proposal started out between 3 to 5%. I think the Senate language is around 4 something. There are, you already see it, you know, as soon as you propose a change, the stuff starts coming out of the woodwork. No, you can't do that. It'd be terrible. But I know this: the last 2 years, property tax valuations have gone up about 15% per year. That is not sustainable, especially for our seniors. Right. We need to take a look at that, a serious look. So that would be the first one. The second one from the state that a lot of people in the eastern side of Kansas don't think about is water. Right. And again, you look to the Ogalla Reservoir out in western Kansas where farmers and ranchers irrigate. There is a need to take a look at water management. And last year, I don't remember the exact tax figure, it was between $40 and $80 million, I believe, where we set up a structure that the governor actually funded that said we're going to take a look at preserving water in this state. So that has legs. That will continue to have legs, and that has legs on both sides, both parties. So that's another good one. And then for me, I mentioned it. The last one is there are roughly 5,300 residents in this state who have what's known as an intellectual or developmental disability, and there's another roughly 2,000, so over 7,000 Kansas who are on a waiting list to receive services for their disabilities. And when you think about Medicaid expansion, what would happen to those 7,000 people is they would go to the bottom of the list. That's just the cold, hard reality of it. I have we have some constituents in this district that I know personally. They have a daughter who got on the IDD list in June or July of 2013. They just received notification in December of 2023 that she's now she's off the list, and she's available for the services that she needs, whether it's for
10 years.
A 10-year wait.
Yeah.
And I have been working on, and surprise. That's one of the things. It does surprise me. Governor Kelly, in her 5 or 6 years in office, has never put any additional funding to clear those lists. You hear a little chatter out of her office now that maybe we can get some traction there, but it is something that, at least on the Republican side, there's a serious effort, I think, underway to help that. In fact, the last governor that did it was actually Brownback, I believe, was the last person who put additional money to help get people off those lists. So, unfortunately, and this is I was talking to Representative Will Carpenter. He's the chair of the Fed and State Committee, but he's also been behind the effort on IDD as well. He said, Dave, you can't throw $200 million at it, or whatever the number is, because there's not enough providers. So you have to go at it incrementally.
Right.
I think the ask that I've seen from KDADS, which is the Kansas Department of Aging and Disability Services, is about $25 or $30 million. That would take about 20% of those people off the list in a year. To me, that's progress. I would much rather do something like that to take care of Kansans who could use our help than to put able-bodied people on a Medicaid. I mean, that's just a difference for me. So, again, I have a hard time sometimes with short answers, but those three things would fly under the radar. Then the wild card would be you can't predict. I said, I started out by saying what starts out as a pen turns out as a pencil. We still have about 2.5 months of the session left. So who knows?
Well, and I know we talked about this a little bit last year because it was easy to see, and I think federal COVID money had a lot to do with this. But who would have thought 5 years ago, when everybody's scrambling and fighting for every dollar, to then say the state of Kansas is flush with, it might be a little bit overstating, but Kansas is flush with cash right now. So if you have any kind of program that you either want to enhance, build upon, or even start, this is the time to try and do it from a financial standpoint.
It is. It truly is.
Yeah. Okay, I've been speaking with 40th District State Representative Dave Buehler from Lansing. For Movers and Shakers, I'm Ken Miller.